Good morning, everybody, and welcome to this morning's webinar. It's 10 o'clock, so we start again with a 10:10 webinar on the lessons learned for CEN and CENELEC from the COVID-19 crisis. My name is Els, and I will be moderating this webinar in the background. As usual, we are muting all attendees to keep this fluent, but you have the possibility to enter your questions in the Q&A panel of this webinar. So please do not use the chat because that is a bit difficult for us to handle, but use the Q&A part where we will see your questions coming in. As far as possible, the presenters will be replying your questions either during the webinar or in a written way also during the webinar. If your question remains unreplied today, please note that we always create a Q&A report that we'll make available for you on our website. So this is the Q&A panel. Please use it if you wish to ask us a question. Should you be on Twitter, please let us know about this webinar. You can always have a tweet on this. Our handle is standards4EU, and we have a dedicated hashtag 1010webinar. So please, let's take a moment to introduce the speakers of today. My colleagues Brecht Lijn and Jennifer Ogbonna will be presenting you our lessons learned from the COVID-19 crisis. So without further ado, please, Jennifer and Brecht, the floor is yours.
Thank you, Els. I'll first briefly take everyone through the content of today's presentation, and then my colleague Jennifer will start presenting her parts. So what's on the agenda today? We wanted to present a bit what the COVID-19 pandemic and the unfolding economic and health crisis has meant for CEN and CENELEC as two out of the three official standardizers for the EU. And how we've handled this is, on the one hand, first we'll introduce some of the immediate crisis responses that CEN and CENELEC managed to formulate in the early months of the pandemic, and later on we then turn to the more mid to long-term lessons learned and the best practices that we identified throughout this experience. And by the end, we'll formulate a number of key takeaways in terms of lessons learned throughout the crisis and how we incorporate that as we go forward, in particular as we start implementing our new strategy 2030. Then on the next slide, we start with one of the first crisis responses that we formulated or took as early as March 2020, which was the establishment of a CEN and CENELEC crisis response network. So this was a network that constituted both crisis managers from the members at national level. We had about 25 national level representatives joining us on a very regular basis, and supported by a smaller network of 5 people here at CCMC with thematic expertise. So the aim of establishing this network was really to facilitate a very regular, dynamic, informal exchange between CEN and CENELEC members to flag common issues of concern that we needed to deal with, perhaps at the European level or raise at the international level at ISO and IEC, and to be able to forward those concerns or those issues of common interest to our governance and advisory bodies to then properly address those issues in a very fast manner. We included, where possible, we included input from stakeholders as well, where they had questions, for instance, regarding the imports of medical devices and PPE products, and what they needed from the standardization bodies in that regard. And a third and final dimension of the mandate of the network was, again, more on this mid to long term, and to identify best practices to exchange lessons learned from each other, how different members had handled similar challenges and what they learned from that, and what others could learn from their experience, of course. Then one of the as you can see, the network operated virtually, of course, considering the restrictions that are still in place today. So we had a Teams environment with where people could chat, but we also had more regular thematic meetings on issues that had been identified as very pressing and required a European response, or at least an exchange. So some of the issues that we tackled here will be addressed later by Jennifer, but just to give you an idea of the issues that the network occupied itself with or tried to address. For instance, where a technical assessment of equivalence between Chinese standards for PPE and medical devices, and an assessment of equivalence then done by our European experts. Also discussions on the free availability of European standards in response to requests from the European Commission, and Jennifer will elaborate on that. How different members developed different types of support services and guidance materials for the standards, because as we'll elaborate on in a bit, we encountered a lot of new types of stakeholders and standardization users, and many standards, of course, are not self-evident in terms of interpretation or how to apply them. So that many of the members developed specific support services, helplines with, for instance, technical experts to support many of these new producers or new standard users. And then finally, and this is where we will get back to when we discuss lessons learned and best practices, is this member survey that we ran over the summer of 2020 to do an initial preliminary impact assessment of how the crisis had affected our members, both financially, but also and predominantly what they had learned, how, for instance, their stakeholder engagement had changed throughout the experience, and the best practices identified through that. But without further ado, Jennifer will take you through some of our initial crisis response actions from a business continuity perspective. Thank you.
Jennifer, you're muted. We don't hear you.
Yeah. Sorry. Thank you, Brecht, for that clear scope of today's webinar, and for setting the scene. So what did we do? What was the first response of our members immediately to respond to the crisis? The first thing our members did was to ensure business continuity by providing flexibility. As Brecht mentioned, we went from physical to virtual meetings, and access was granted to experts for remote participation. And we saw that it lowered the threshold for participation, which led to an increase and more diverse stakeholders that were interested to participate in standardization activities. So we saw stakeholders from small businesses and startups, from entrepreneurs, from companies that import and export PPE and medical device products. Also not on the screen, we saw stakeholders from healthcare institutions, from doctors, etc. A further response that our members took was to grant a 6-month extension to the standard development process. As some of you on the line may know or not, it takes about 2.5 years to develop a standard. However, with the COVID-19 situation, it was quite challenging to meet some of this timeline. So in order to reduce the pressure on standards drafters, our members agreed to give a 6-month extension. As a further response, our members also agreed to a flexible standard development process for our technical committees to autonomously plan and organize their work. I know it sounds a bit abstract, but this is quite a very interesting topic, and we had 3 dedicated webinars to this topic. If you would like to know more, I will invite you to use the link after the webinar to have more information on this process. Following stakeholders' questions and feedback that we received during the crisis, our members agreed to create a feedback mechanism following the publication of a standard, which allows users of a standard to identify the national standardization body to whom they have to address their questions, inquiries, or questions for clarifications. We also created landing pages with frequently asked questions to gather relevant COVID-19 information. The notorious questions that we got are, for examples, what are PPE, what are medical device products, what are the legal framework for these products, who are the competent authorities for the conformity assessment of these products, and very interesting to know is how do Chinese COVID-19 standards compare to the European ones, which is quite interesting because there were companies here that were interested to either import Chinese products, or there were Chinese companies here that were producing products and they wanted to know if their products were in conformity with the European legislation. So yeah, we got so many different types of questions. As Brecht said, also, there were a use of a drafting of sectorial guides, online trainings, webinars, communication campaigns to really raise awareness and to help stakeholders to guide them on where to find the relevant information. So yeah, the next topic of interest is on standards and standardization. What we did different actions at European level, national level, and at international level. So let's start first with European level. Our members agreed to make for free the availability of medical device and PPE standards used in the context of COVID-19 pandemic. These are like the typical products that we're using during the pandemics, like the surgical mask, standards on medical gloves for single use, the PPE mask. However, this free availability of these standards were a temporary and exceptional measure to enable companies reconvert their production lines and to tackle the severe shortage of PPE and medical device products that Europe was facing at that time. A further response in terms of standardization is the publication of a CEN workshop agreement on community face covering that was published last year, June 2020, which was coming as a request from the European Commission. This document was published under a fast-track approach under the stewardship of our French standardization body, AFNOR. Our members have recently agreed to convert this document into a technical specification to allow for a wider participation, and there's also an ongoing discussion to extend the scope of this document. The work is being done right now by our CEN-TC 248 on textile and textile products. If you wish to know more on the work that is going on in this document, I will be pleased to put you in contact with my lovely colleague who is following this dearly. At national level, it will also agree that our members could continue making all the standards for free that they thought was necessary to continue fighting against COVID-19. And we have a total of 156 additional deliverables that were made for free. Like I said earlier, this was an exceptional measure that was limited until that was limited to last year, June. However, upon further assessment of the pandemic, our members agreed to extend these measures until this year, March, just of recently. And we have a record of 350,000 downloads from all these free standards that were made available. Also, yes, at international level, what we did was that the International Administration of China carried out a technical assessment to check the equivalence between the European and the Chinese medical device and PPE standards. So these, for example, the surgical mask, the medical gloves for single use, etc. However, following concerns that were coming from stakeholders and concerns about the conformity of products that were being imported into Europe at that time, it was needed. It was discussed by our members in the network that my colleague has mentioned. There was a need for a European validation of the comparative analysis that was performed by SAC. And the outcome of this comparative analysis by our European experts was that there were similarities and differences between, the Chinese products and the European products. However, these products is not a legal basis for a third party to choose Chinese products, because there were comparison that was based only on the technical information that was in the standards. Also, at international level, we got requests from several countries to adopt European standards during the pandemic, like Ghana, Jamaica, South Africa, Philippines, etc., to adopt the following standards that you see in front of you. So now I would like to discuss the initiatives that were generated by the crisis. Right now, we are developing a European deliverable on COVID-19 health and safety protocol for tourism, which is also coming as a request from the European Commission. So the first step will be the European adoption of the ISO PAS 5643 on tourism and related services, which is right now under approval at ISO level. So once this is published at ISO level, CEN will adopt this document. And as a second step, we are developing a part 2 to the first ISO document to complement it. This second purely European document will provide a visual identity label that will be displayed in touristic establishments. The document will also provide requirements and guidance on how to use this visual identity. The work is being developed by our CEN workshop on Europe Safe Tour, and the publication date is intended for May 2021. The aim is to ensure a safe reopening for all EU citizens in all the subsectors of tourism. The work is under the stewardship of our Spanish standardization body, INE. And if you wish to have more information on this work, I will be very pleased to put you in contact with my amazing colleague, Christina Tungrim, who is following this very closely. A second initiative generated by the crisis is the need for sustainability for PPE, given the amount of disposals and waste that has been generated through the crisis. So for example, you see a lot of masks on the floor, and the bin, or just everywhere. So there were quite some concerns that was raised within our experts, and there was interest and commitment for our experts to go in this direction. So what we did was that on the 8th of March, we organized a workshop on sustainability in PPE to address the challenges through standardization. It was a very interesting workshop with about 400 participants coming from a diverse audience. Just to mention a few, we had participants from designers of PPE, cleaning services of PPE, researchers, notified bodies, etc. And the workshop highlighted the challenges and experiences of sustainability and PPE, and how standards can be the solution, can play a role in tackling this issue. All the materials and support that we use during the event can also be found on our website. So right now, I'm going to give the floor to my colleague Brecht to take you through the lesson learned and all the best practices during COVID-19. So back to you, Brecht.
Thank you, Jennifer. On the next slide, you'll see the cover of the report that we produced early this year, and that was the result of the survey I mentioned earlier on in the webinar, where we assessed both the ongoing impact of the COVID-19 crisis, as well as more generic lessons learned from that crisis. And so we've summarized those in first in a governance report that was circulated to to our governance bodies in November, and then a more public friendly version was published early this year. I'll talk about three dimensions or three aspects. The report is online and is a bit more comprehensive, covers dimensions such as human resource management as well, but we'll stick to digital transformation, business models, and stakeholder and policy engagement today. As is true, I guess, for a lot of sectors, the COVID-19 crisis was in many respects a bit of a wake-up call, and intensified a number of ongoing trends. And for us, digital transformation was definitely the most prevailing one in that regard. We've been investing in digital transformation, both in terms of our own processes and the products or the outputs they deliver, for quite a while now. But the COVID-19 crisis was definitely has definitely created a momentum to speed up and upgrade our investments in that regard. As Jennifer already mentioned, we did our very best to ensure the continuity of standardization development throughout the pandemic, when people were no longer able to meet as they usually do, either in our offices or at the conveners. But so we facilitated that process virtually as best as we can, and as we saw from TC work that over 90% of TCs pretty much seamlessly to process or continued their activities online without major difficulties. Like I said, digital transformation is something we'll be investing in a lot over the coming decade. It's also identified as one of the key goals under our strategy 2030, and we see this in different ways. So one way is the need to develop smart standards, so standards that can be interpreted and applied and read or machine readable, so who can be seamlessly integrated into business and operating procedures of our standard users, but also to facilitate a more agile, collaborative online production process to be able to meet the demands for faster standardization or faster standard development. Obviously, at European level, we look at the international level for international solutions. We don't want to create overlapping tools or do double work. So we're not waiting for their solutions, but we are we're heavily investing in developing these type of work streams at European level exactly to support and influence the work in that regard at international level. And as soon as international solutions are available, they will be applied at European level in that regard. Beyond technical innovation, and this is more process and human resource management wise, we've realized also that not everything can be replaced by virtual meetings from time to time, depending on the nature or the objectives of the meetings. Physical engagement is still offers considerable added values when you need to brainstorm or sensitive issues are on the agenda, for instance. So we need to now in the coming years develop a smart policy on how to decide when a meeting is best held online or in person. Other lessons learned there, not specifically or not specific to to CEN and CENELEC, of course, are the importance of well, keeping a clear communication, trainings and skill development to deal with this digital transformation. But then a second item or second lesson learned, and notably in the area of stakeholder and policy engagement, is that we've seen that many of the stakeholders that we already well had a close engagement with, including at national level, that those ties became stronger, and perhaps most interestingly, we also managed to reach out to new types of stakeholder audiences, which previously seemed hard to reach or hard to convince of the value of standards. So I think for us, COVID-19 clearly exposed the real life, day-to-day added value and use of standards and a standardization system, and then specifically for policy makers, and particularly at the European level, we've seen a new momentum that acknowledges the need to facilitate a well-functioning European standardization system, and there's really been a sort of change in attitude and a renewed openness to address those some of those long-standing pain points, for instance, in relation to citation, to really address those and to look at how we can cooperate and tackle those long-standing pain points. In terms of best practices, several of our members developed very innovative, tailor-made outreach and engagement campaigns. They've engaged with national media, set up hotlines with technical experts, developed sector guidance, developed consultancy activities, all sorts of outreach at very different levels depending on the stakeholder audience were developed, and now we're trying to consolidate that broader outreach base, if you wish, into more concrete business opportunities. So really keeping those people on board and developing specialized, targeted, value-added activities to materialize that outreach into concrete business opportunities. Then on my next slide, this segues sort of into business models. Here we saw, perhaps unsurprisingly, that the reduction in sales as we made some standards freely available affected different members differently depending on their business models, and obviously business models that relied on a more diverse revenue model were impacted less. But we also saw that those who were impacted did in a quite an impressive way, where it showed an exceptional degree of agility and innovation in developing new business cases around those newly developed services and products, including around free standards. So those are things that we're looking to further explore as we implement our strategy 2030. Obviously, to be clear, CCMC or CEN and CENELEC at European level don't dictate our members' business models. So those are decisions that have to be taken at national level. But what we can do is to facilitate an open and innovative or an open exchange to further explore innovative, more resilient business models, and to tie those lessons learned from the COVID-19 crisis to also what digitalization and digital transformation of the products that we deliver and how we deliver them, what that means for our business and financing models. And on the next slide, I briefly wanted to point people's attention to the Strategy 2030 that we developed and adopted in November last year. You can see the four goals there. There's one missing goal. I see that's the goal on international relations. So, but the idea is that we take we finished our strategy as the crisis, as we were sort of processing the findings from this lessons learned report. So those have been incorporated in the new strategy, of course, with a long-term perspective. And what we're doing now is developing an implementation plan for the Strategy 2030. So breaking down the goals and priorities identified under the Strategy 2030 document into tangible projects and more concrete objectives for the first years to come. And there, specifically, those lessons learned from the COVID-19 crisis have influenced our prioritization of the projects that we are considering. So notably in terms of our engagement with the EU to tackle those long-standing pain points in relation to the timely citation and the delivery of standards. And on the other hand, this digital transformation and the how we produce our standards and the type of standardization or standard deliverables that we produce. But I notice we're already